Sometimes making the right diagnosis for a patient, even in cosmetic cases, is just as important, maybe more important, than performing an operation well. This is a woman who came to me asking for a breast reduction. When I examined her and I took a good look at her anatomy and discussed with her what she really wanted, it became a little bit more clear that in her case, she needed a breast lift, not a reduction. In the photographs that you're looking at right now, I took away skin only and performed a wise pattern breast lift, also known as a mastopexy. She happens to make excellent scars, and I'm sorry that I can't show you the nipple areolar complex. She started off with an areola that was very, very large and wide, and it really made her distressed. Her breasts basically pointed at the floor. After the lift, she is certainly a little more perky, a little bit more athletic looking, and she's much happier. Now, in this result, there is no breast implant. I have met a few patients over the years who were told, as part of their lift, that they needed to have implants. There's a little bit of truth to that sometimes, but not in this case. And this is my point that I started with. I think it's important to really sit down and talk to patients, figure out what they want, and make the right diagnosis so that you can come up with a surgical plan that will be more appropriate. This lady had plenty of her own breast tissue, and there was no reason to put an implant in. Making the areola smaller, lifting the breast tissue, all ended up creating a much more pleasing aesthetic result for her. But if I had gone out from the beginning and performed a breast reduction for her, I personally think that her body would not have carried breasts that were much smaller very well. So when all was said and done, a lot of patients have asked me if this woman actually has breast implants. But those aren't implants at all. It's all her. And I'm very pleased with the way she came out.